Thanks very much for joining us for episode 43 of InTek Freight and Logistics, the podcast. I'm Kevin Baxter, joined by my co-host for this edition, InTek CEO Rick Lagore. Rick, how you doing?
Thanks again for having me back.
Well, it's not just me having you.
Well, it's a combination.
All right. On this episode, we're focusing on moving a critical freight type, pharmaceuticals, and how a top firm navigates the process across the country. With our guest, Joel Wayment, Vice President of Operations at Cardinal Health 3PL Services. Joel, thanks very much for joining us.
No, you bet. It's good to be here.
So first off, tell us a little bit about your background with Cardinal Health. I know you've been there with the organization for quite some time, and what you do now with 3PL services.
Yeah, you bet. So I joined Cardinal Health about 19 years ago, and all that time has been really with our third-party logistics business. And so it's been a great journey with Cardinal Health and in really focusing on how we help our manufacturer partners moving product through the supply chain to get to those patients who need them most. And
so explain a little bit more about the 3PL piece. You think of a 3PL as one company, but Cardinal Health is Cardinal Health too. So how does that relationship work? And do you serve just Cardinal Health, or do you serve other customers as well?
Yeah, no, great question. I think a lot of folks that are familiar with Cardinal Health probably most often think of the wholesale distribution business of Cardinal Health, right? That's a very large part of Cardinal Health. But on the 3PL side, we're really working with pharmaceutical manufacturers on helping them as they work to commercialize their product into the market. So think about when a manufacturer once gets FDA approval for their product, now you got to figure out, okay, where's the finished goods going to be stored? How are you going to manage all the order to cash activities? So, the customer service aspects, the order intakes, the pick, pack, ship, and moving the product through the supply chain. So there are a lot of companies, a lot of pharmaceutical manufacturers that don't have the infrastructure to do all those activities. So we do that on their behalf. So they look for a 3PL where they outsource those activities too. So I'm acting on behalf of the manufacturer and helping to move their product to whoever their customer may be, whether that be hospitals, whether that's wholesalers, specialty distributors, specialty pharmacies, things of that nature. And so then once we are fulfilling the orders and moving the product through the supply chain, we're handling all the invoicing, chargebacks activities, other aspects that are your back office order to cash type functions.
We're talking obviously in the pharmaceutical realm. Moving freight is different depending on the type of freight, no matter what. But pharmaceuticals, that's a very specialized type of freight and a very important type of freight as well. So how do you go about that, and how is that different than your average good?
Yeah, and I will tell you, in the pharmaceutical space, the products are getting more and more complex from a management perspective, from a storage and distribution side. So, we support various different types of products that might be what we call control room temperature, right? So that's your ambient temperature space. We work with products that are cold chain, whether that's 2 to 8 degrees Celsius refrigerated, or products that are frozen or ultra frozen, or products that even require liquid nitrogen. So your cryo type storage and shipping activities. So, we provide all those solutions to our manufacturer partners to help move those products to make sure that their products are maintained in the right temperature requirements and conditions associated for that product. And so what we've seen over the years is that, the FDA, as they approve more and more of these products that are coming to market, about 50% of the products that the FDA approves today require some element of cold chain handling. So for a moment, think about a product that is required to be stored at minus 80 degrees Celsius. And so now you've got to have the right, systems, technologies, and capacity to store products in those temperatures. But that storing it, now you got to move it through the supply chain. So that requires unique coolers, unique devices to help move those products to maintain that temperature throughout the entire time in transit.
Yeah, and just like one window of something not going quite right could be really catastrophic, right?
Right. Well, and the weather here in the U.S. is always predictable, right? It's always sunny and great, but you have to think about, okay, where are you shipping the product to? Is it a region that's really hot? Is it really cold? what's going on in that area. Is there disruptions? I mean, little things that a lot of people don't think about is that, I sometimes worry about when somebody wins the Super Bowl, what town are they going to be celebrating that Super Bowl? Because that could delay shipments getting to customers, getting to hospitals. So we have to think about those things when we're moving product through the supply chain as to what the conditions are going to be, not just where we are, but where the product's going. And how do we ensure that product maintains the right temperatures and is traveling in safe conditions throughout that journey.
So, in speaking of the consumers of your product or your service, where are you shipping it to? Are you shipping it direct to store? Are you shipping it direct to hospitals, or it's going in another distribution network to get to the final destination? Or how does that play out?
Yeah, we support our manufacturers with any of the channels that they might be going through, right? So we're what we call channel agnostic. So that could be the manufacturer's product may go to wholesalers. It may go to specialty distributors. It might go direct to hospital, might go direct to pharmacy. So we're supporting all those different channels based on what the manufacturer's need is for their specific product.
Okay. All right. In terms of talking about some specifics, there's a couple acronyms that we're going to throw out during our conversation here. One of them is the EPTN initiative. Could you explain what that is, what that's all about, and why it's important?
Yeah, no, I'm super excited about that. So first, let me define EPTN because our listeners may not know what EPTN stands for, right? It's an acronym that we gave it because we created this model back in 2009. But EPTN stands for Exclusive Pharmaceutical Transportation Network. So many years ago, we looked at all the data that we had at our availability to understand where all the products were going across the network. And we said, there's got to be a simpler way, a better way to move products through the supply chain. So we created this network of routes and milk runs, I guess the way you can think about it, where we have dedicated trucks going to stops and we're consolidating freight that's going to the same locations. So that enables us to reduce the amount of packages that we're putting out into the network and on the road by consolidating them into a temperature controlled truck that's going to these destinations. So we can ensure the product maintains the right temperature and specs that's required, but we can reduce the number of trucks on the road, the number of packages we're putting out there, but still delivering a higher level quality of service to our manufacturer partners. So it's been a great model for us and for our manufacturer partners by having this network of lanes and trucks set up to simplify the movement of product through the supply chain.
So how many distribution centers do you have out there?
So on the 3PL side, we have two physical locations. One is in Laverne, Tennessee, just outside of Nashville, Tennessee, and our second site's in Reno, Nevada. Now, on the wholesale side, they've got many more distribution facilities that they operate, right? So upwards of 26 plus different DCs just on the wholesale side for Cardinal Health. But for 3PL, we have our two main locations that we operate out of.
And the goal in terms of delivery schedules, 2-day is what you're trying to shoot for?
Yeah. Well, okay. It varies based on the product and the type of product that it is. So if you think about cold chain products, that usually is going to ship out next day, right? So next day delivery, because you want to ensure that the cooler that it's shipping out in can stay at the temperature it needs to for the duration of the transit. But there are a lot of products that are shipping out in 2-day or ground is very common based on the nature of the product. So I would say a lot moves ground, a lot moves, next day or 2-day, but we also move a lot that we refer to as LTL, right? So less than truckloads. So you've got, partial, what I would call semi shipments that are going out or full truckloads that are going out.
So are you running your own assets, or is it a combination of asset and non-asset as you're doing this distribution?
Yeah, so Cardinal Health and the 3PL business, we don't own any of the trucking assets, right? So, but we contract with qualified vendors that we utilize to move the freight through the supply chain. So a lot of our parcel shipments are going to go out via FedEx, right? And then the truck shipments, we're going to go through kind of a contracted fleet of companies that we work with to support the movement of those products.
So going back to the EPTN side of things, the consolidation bit, how do you coordinate that with your partners then to get those loads full and eliminate the empty space?
Yeah, again, so we talked about when we looked at the data of where our freight was moving that we were supporting, we identified that 70% of the units that were going to similar destinations across our manufacturer partners that we support. So we took that data and then mapped out the hot spots of where product was moving and would provide the greatest efficiency to our operations and to our manufacturer partners. And so we created, roughly 19 lanes, and each one of those lanes will have, approximately 7 to 8 stops on it, where the most common locations are identified where we're moving freight. And so once you built that network, then we can begin to move freight and work with the customers on when they order, in time for when the trucks are leaving, so we can have as much freight as possible on those trucks going to those destinations. And then we do a constant review of our network to say, okay, are there new locations that have popped up that make sense to add to our network based on the volume that's going there? So we're very conscientious about, there needs to be enough volume to make it worthwhile for the carrier, for us, for our manufacturer partners. But, we want to eliminate overpacking and additional trucks on the road if necessary to ensure that we get the products to the customers on time.
So as you put this initiative together and developed it, was it an easy sell to your customers that you serve today? Did they fully understand it? Was it something that took some time and a little frustration as well?
Well, yeah, it did take a little bit of time, right? Change is change, right? And we don't always adapt to change very well, very fast. I will tell you, you always have your early adopters, but then you also have your laggards, right? So when we first put this model together, we spent a lot of time meeting with our manufacturer partners and explaining the model and the benefits of the model. And you always need to find that one or two that are willing to jump in and kind of be your pilot to get going. So we were fortunate enough to work with a wonderful partner of ours that was willing to jump in and try out this new model. And over time, it caught fire pretty quickly, and people realized the benefits from it. But again, when you're moving product freight like pharmaceuticals, that can be very expensive. Right. When you're talking about, millions of units that you're moving, that can have a high cost. And so there's always a hesitancy on, hey, if you're changing the method and how products moving through the supply chain, do I feel comfortable with that method? How do I get comfortable? And so having a few early adopters really helped kind of demonstrate and validate the outcomes that we expected to get from this model. And really the outcomes for our manufacturer partners was, one, we could reduce freight spend, for them. But we also reduced, and this is probably the bigger benefit, we reduced the potential for damages in transit, the potential for lost packages, right? Which means lost product. And that has probably a higher cost and impact back to our manufacturer partners. So the fact that we can reduce costs by consolidating freight and running these networks, but also improve the accuracy and the overall condition of the package when it arrives, provides a huge benefit back to our manufacturer partners.
Got it.
So you talked about truckload, LTL. Do you ever use any other freight modes? I mean, maybe the overnight thing involves some air as well.
Yeah, absolutely. So obviously we use, like I said, for our parcel shipments, we're using FedEx as our parcel carrier. And then for the less than truckload or the truckloads, we have obviously contracted groups of companies that we utilize for that. But then when you get into your more, I would say, specialized, products that are your ultra low cold storage stuff, right? So now you're talking the -20s, -40s, all the way to -196 degrees Celsius. With those, right, because of the sensitivities, you really need a really, specific white glove service to move that through the supply chain. So we use couriers, right? There are different kinds of couriers that are out there that have the various fleets of, whether it's, getting product, through the airlines to a courier that's then hand delivering that to a location. So we work with the various couriers to kind of help move those specialized shipments.
Jumping into another acronym then, and as you were trying to sell this whole the network to folks, the other acronym is what is it? The DSCSA. Was that something that helps move along the initiative, or how did that play out? And actually, yes. Our listeners and like myself, I had a hard time reading it first.
Should have put some hyphens in there.
Well, I should have put my glasses on actually, but. Explain to our listeners what it is and what's it about, and We can go from there.
So DSCSA, right? So again, I'll start by just defining the acronym, right? But that stands for Drug Supply Chain Security Act. And so this was a law that was passed back in 2013 that had a 10-year implementation timeline associated to it. And so that law really was focused on, not so much how the product moves through the supply chain, but ensuring that when product goes from point A to point B to point C, that the end product is correct, good product, right? So I think we're all familiar to some extent of the potentials for knockoff products in the market, and so you want to ensure and really provide that assurance to patients that the product you got truly is the product you were intended to get. And so the DSCSA is really more of a focus of how product is tracked and traced throughout the supply chain, so that at the end of the day, the consumer that's getting that product knows that this is valid, good product, not some knockoff that entered the supply chain by some nefarious characters for some reason. So that's what DSCSA is about. So it doesn't impact the mode of transportation or how it's being moved through supply chain. It's more about how we are communicating with our downstream channel partners on providing them the information they need so they have the assurances that the product they got is the product they should have got.
Right. And then if there's any recalls, it would be easy to be able to recall that product and make sure that all of it was removed from the shelves or from the supply chain that was already put out there.
Yeah, I think it definitely helps. I wouldn't say that it's easy, but I would say it definitely helps. And as you have greater insight with the tracing of product as it moves through the supply chain, of knowing where that product went all throughout the journey.
Absolutely. Back in my day, we used to do managed one of the larger food and beverage companies. And if there were some problems, we had to track back those lots and find where those all were and pull them back in. Clearly in the pharmaceutical, is probably, I'm sure it's even more critical to make sure that the right product is at the right place.
Yep. And that's what that law is all about, right? And the industry has been working very diligently over the past several years to prepare to make that happen. And that's not an easy process, right? You've got to get a lot of stakeholders aligned and sharing and communicating data in the same fashion that everybody can interpret and read and use, and how you pass it along the supply chain. And so it has been a huge monumental effort by the industry on focusing on that, but they've made a lot of great progress, a lot of great strides and progress in getting that completed.
I'm still getting over the back in my day there. That was
been doing this for 35 years.
Anyway,
time flies.
Well, so you brought up the potential for fraud with these loads. Are you seeing issues? I mean, I know we've seen over the last couple of years in the freight industry as a whole the worries about cargo theft. Is that something that that's always got to be top of mind, obviously, for pharmaceuticals especially?
Yeah, no, it is, right, and there's a lot of work that's being done by our industry on making sure that we're mitigating those risks, right? And you can't 100% alleviate them; they're there, but there's a lot of things that we do as an industry to make sure that we prevent that from happening as much as possible. So going back to our EPTN network that we built, we incorporated several aspects into that network to ensure the security behind the movement of those products, right? So I'll give you an example is that, there's an organization that we are associated with, part of an industry organization called HTA, right? So the Healthcare Distribution Alliance Group that really focuses on with the wholesalers and manufacturers and what's taking place. And so, as part of that organization, there's a lot of data they share around what are we seeing with truck hijackings and thefts and things of that nature, right? And so what are kind of the trends? And so then you can try to build models around how do you prevent the things from happening that you're seeing out of the market today. So as an example, with our network for EPTN, it's always team drivers. We don't use single drivers, right? And part of that's because with a single driver, when you've got a long haul, they've got to stop every so often and they've got to rest and sleep and things of that nature. And some of the data was showing us that when a truck is stopping at a rest stop or other places, that's where the potential for hijackings and things to happen. when a truck driver goes to a gas station or stops to get something to eat, if it's a single driver, they go in, truck's left unattended. But within our network, when you've got two drivers, our requirements are like there's always got to be someone left with the truck. You can't leave the truck unattended. But we also design our route such that trucks aren't stopping at a rest stop and sleeping overnight. So the wheels are always moving, right? So again, if you keep the truck moving, there's less risk that you're going to see. Also, we have requirements like, hey, when the truck shows up at our location, they got to be fully fueled and ready to go, which means they can't stop anywhere for the first 300 plus miles unless it's a customer destination. Because we've also learned that, hey, a lot of times those nefarious actors that are looking to hijack a truck or to steal freight, they're not going to follow a truck for 300 miles. Like at some point, they're going to give up on that, right? So we really kind of put these things in place to try to minimize the risk. And I'm looking for wood to knock on, right? But we've not had those issues with our model, and we've seen a lot of great success where that's not been a concern or an issue that our customers or the patients that these products are going to have to worry about.
Understood.
So in your time there, I mean, you've talked about obviously the need to ensure that the temperature stays stable the whole time. And now we're talking about tracking the loads too. So how has technology evolved to make it so much better for you to be able to, get to that granular level of data all the time?
Yeah, no, I mean, it's evolved a lot, and I would tell you that it's still evolving, right? It's not done evolving. But now we have greater visibility to things as it moves through the supply chain, right? So before you give your package to somebody, you might get a tracking number and you can check to see like, hey, is it delivered yet? But you really couldn't see what was happening while it's in transit. You didn't have that kind of visibility. So I think there's greater transparency and visibility to that information today. So whether that's various devices that you can include in the packages that tells you, hey, this is where it's at along the entire journey, not just did it reach the next point to be scanned and it was scanned there, like where is that in that process? But with products, for example, that are these really rare disease type products, right? So you're talking now, you're cell and gene therapies. What's really neat about the technology that's there today is that as these products move through the supply chain and these very unique shippers that they utilize, you can not only determine and see where it's at along the journey the entire time, you can see if that container was tipped on its side and if it was, for how long, and because that may impact, the liquid nitrogen and the life of that shipper. So there's a lot more technology that's employed today to really understand not just where it's at, but how it's moving through the supply chain. Did it get tipped upside down? Did it get put on an angle for too long? And that could be a concern or an issue. So then all that data then feeds back to the providers to say, here's what's happening, to make an assessment to say, is this still okay or is there an issue? We utilize technology. It's not our technology, but the technology that our partners that we work with have, such as back to, I'm going to beat the drum on EPTN because I think it's an incredible initiative. But even for EPTN, the organizations that we partner with, they're monitoring those trucks in transit the entire time. And they use what's called geofencing. So geofencing, we basically say we map out the route where they're going to take. And if the driver deviates from that route, there's an immediate alert that goes to a group of individuals so that if we have to engage law enforcement in that area, we can, and we can move fast. In addition, a lot of these carriers have the ability to remote into a truck and shut the truck down and bring it to a stop if they need to. Now, for our listeners, I don't want them to worry about like you're driving on the freeway and all of a sudden a semi just comes to a screeching halt. It doesn't work that way, right? So when they go to stop a truck, it reduces its speed like 10 miles per hour at a time until the truck comes to a stop. But there's different technologies like that really enable us and give us better visibility to where is my package, but what's the condition of my package in during the time of its transit.
And it allows you to make any kind of adjustments as well, as you were saying. If you check something afterwards, is there an area where there's a traffic jam that might be so bad that it's could cause ripple effects too?
Correct. Well, and given the various weather events that we've had here in the U.S., right, we're constantly monitoring what's going on with weather. And if we see all of a sudden that there's a particular part or region of the U.S. that's been hit hard with a storm that's just come in, that may dictate changing the plans. It may be, hey, bring the product back to our location or reroute or do different things so we can ensure that the product arrives at its destination in a safe manner.
So with all this data, you mentioned, I mean, we've talked about EPTN a couple of times already, but another evolution in technology is the growing use of AI, and freight is certainly no exception in that. But tell us how you've been using it so far and where you see it even going further.
Yeah, I mean, in the 3PL business, we don't utilize AI today yet, but it is something that Cardinal Health does utilize and continues to evaluate, right? And I would tell you, I think AI continues to evolve, and we continue to learn about the possible uses for AI and its application in the things that we do. So, really, for us, at Cardinal, we're focusing on how can AI improve the efficiency of what we do, but also simplify it. So, part of our supply chain and the work that we do can be very complicated. And you don't want that complication to be there because it creates challenges as product moves through the supply chain. But you also want to create the right customer experience. I think we've all had experiences of going online, buying something, and maybe not having the best experience in the world, right? And so AI, it can help simplify those experiences by creating greater options and self-service functionality for the end user to do things that they want to do. But AI also does a great job of how you do your analytics and understanding what's happening in your business that may help you make decisions to change things to improve outcomes. So I think there's still a lot of things to do yet with AI, but we're learning and we're seeing applications within our four walls, within our organization, of where we think that makes sense.
So another big topic, so we'll get off of technology for a little bit here, at least a little bit, is in supply chain. We're talking a lot of sustainability, greening the supply chain. Through this EPTN network, do you measure the improvements in carbon footprint that you put out there under EPTN versus under other modes or other distribution methods?
Yeah, no, it's a great question, and it's a great topic that I enjoy talking about. So, when we think about what you just talked about as far as what our role is in and the things that are happening in our environments pertaining to the carbon footprint or the millions of packages that we're putting out there, we are seeing more and more companies developing great solutions that focus on multiple use, right? So, for example, if I have a cold chain shipper that I'm using, in most cases today, it's a one and done, right? I use this cold chain shipper, I put gels and ice bricks in it, ship it to the customer. That customer's got to then discard that, right? They're going to destroy that product or the shipper. And so we're working with partners that are developing shippers that might be able to be used 3 times, 4 times, right? And how do we drive multiple use shippers to reduce stuff going to the landfill? Locally in our 3PL business, I'm really proud of our team and what they've done as well. We've actually spent a lot of time looking at things as simple as bubble wrap. The bubble wrap that we use when we're packaging these products. We find that, hey, there are some bubble wrap that is more environmentally friendly and also does a great job protecting the product. And so we've worked with another organization on changing the bubble wrap we use, not only because it's better for the environment, but also because it gives back to communities. So the organization we use, that based on the volume that we purchase, as we purchase a certain point of volume, they donate water filtration systems to countries that are struggling to get clean water. So there's things we can do that not only improve our carbon footprint today or reducing it, but also does good in other parts. We also found that when we are receiving product in from our manufacturer partners, and we're getting those gel bricks and those the ice bricks and the gel packs and those coolers, rather than sending things to the landfill, is there other things we can do with those things, right? You can't use some of those gel packs and ice bricks again. They're kind of a one-time use item. But there's other organizations out there that can utilize those items for what they do. And I'll give you a great example. One is Meals on Wheels, right? We identified in our local community, we're at that Meals on Wheels, which is a great organization that provides food for those that don't have it and need it. And we learned that they spend a lot of money on gel packs. And so we were able to work out and arrange with them that, hey, the gel packs that we can't reuse, they can still use. So we can donate those gel packs to them. That reduces their spend on gel packs, and that increases their spend on the meals that they're providing to others in need. So really, our organization has spent a lot of time to say, okay, what can we make sure we're recycling? but what also can we do with these items that aren't recyclable that might have other uses elsewhere that we can partner with organizations to make that happen? So I'm proud to tell you that over 90% of the stuff that I would say gets thrown away in our organization is being recycled. We have very little that's going to the landfill because we're looking at what can we do to reduce that impact on the environment as much as possible. Now, I think we, as a society, we have a long ways to go. There's still work for us to do there, right? But I think, our teams are very much engaged on, hey, how are we trying to improve, the work that we do and how it impacts the environment around us. So, whether it's reusable, shippers that we're using, whether it's the bubble wrap or the recycling efforts we're doing, or the reusable multi-use shippers that happen, I think there's a lot of good that's happening. But and again, I know we've beat the drum on EPTN, right? But I'm going to keep harping on that one just because I think it's an incredible solution that we offer our manufacturer partners. But by utilizing EPTN, that means we're putting less trucks on the road, right? And so by consolidating freight, I don't have to have 10 trucks out there trying to make these deliveries. I can have one. This do multiple shipments. So I think that has a positive impact as well.
Agreed.
Yeah, I mean, the one of the big things on the environmental impact of freight is just it's semi-unavoidable at times in terms of trucks produce a lot of emissions, and you have to move things via truck. That's just kind of how it is. But consolidating the loads, taking them off the road, that's certainly a big step. Are you with partners looking at? I know we're not really there yet, but the electrification side of things, automation, those types of layers to this process, maybe down the road.
Yeah, I mean, we're constantly working with our our partners that we utilize for some of these solutions on what are they doing to continue to evolve in their organizations and their solutions, and what are they doing to also focus on the environment and other things, and what are their goals on reducing carbon footprint. So we are seeing advancements and things moving that direction. I would say we've got a long ways to go. I mean, you think about just the EV vehicles on the road today, right? I think we're still trying to figure that out. And how does that work? It'd be nice to say, hey, where are we at with semis being EV and those types of things? But I think it's going to continue to evolve, right? And we don't know where that's going to land. But we're working with partners that are very conscientious about that and are focusing on how do they continue to improve their operations and their systems and processes to minimize the impact in the communities in general.
Oh, and you've got on the air side, you've got the sustainable fuels that are being introduced and things like that too. So, I mean, how do you balance? Because some of these are more costly, some of these are less costly. As you mentioned, the consolidation actually does save money as well. But how do you balance that equation where you're thinking about the cost, you're thinking about the carbon emissions, and obviously speed of delivery as well for you? How do you balance all those together?
Yeah, it's very delicately, right? It's not an easy balance, but we kind of really say, hey, this is our North Star, and that is the quality of the outcome. We want the right outcome, and what's the best method to produce that right outcome, right? So we want to ensure that product delivers on time in the condition that it's supposed to. So what are the different ways that we can do that? And then we can evaluate those methods and say, which of these methods will produce the right outcome, but also provide other benefits such as reducing carbon footprint, reducing excess waste and things of that nature. So, we're constantly looking at those things to see where we can go, but where our partners are going as well. One of the things that we do quite a bit here at Cardinal Health is we have what's called an operational excellence program, or OpEx for short, right? So we'll just add some more acronyms to our list today, right? But we have OpEx programs where, across our operations, we're constantly looking at how do we improve the processes, because the process that we implemented 3 years ago may have been great 3 years ago, but things evolve. Technology changes and evolves. So how do we go back and revisit those processes and challenge ourselves to look at different ways to do things so that we can become more efficient, we can simplify and provide the same or better quality that we were providing before?
So with sustainability efforts, you're obviously trying, we all are obviously trying to slow down the effects of climate change and hopefully, mitigate those to some degree. But there's already some you've talked about the weather a few times already. So, are you seeing, I mean, even if it's just anecdotally, do you feel like there is more that you're having to adjust to now versus, 10 years ago, 15 years ago?
Yeah, it's a good question, right? If I'm just going off of kind of just, gut and what I feel versus, and you always want to be cautious between there's feel and there's fact, right?
Right. Yeah.
My wife and I get in this argument all the time. Like, it feels hot at the house to me. It feels cold to her, even though the temperature is this way. So we're always in that debate. But I will tell you, over the last couple of years, I'm probably talking about and focusing on what's going on weather-wise more than I used to. Right. So it seems like there are, more events that we're talking about and planning for than what it was historically. Right. So it's been interesting over the last couple of years for sure.
Yeah. Well, before we let you go, the working with different careers, different areas, you get different levels of satisfaction from your job, I think, every day. But you've been at Cardinal Health for a long time. You're talking about therapeutics and pharmaceuticals. How satisfying is it to know that you're moving these very vital products and getting them to the destination, which is consumers who really need them?
Yeah, no, I mean, there's huge satisfaction there, right? And with the number of employees that we have that we're working with, it's something that we talk about all the time. Is that we know today that what we're doing today will impact someone's life for the better tomorrow. And that's incredibly satisfying. When you can come to work every day and say, I know what I'm doing today is going to touch the lives of individuals tomorrow, that gives you purpose and meaning behind what you're doing. So we actually have a program at our 3PL organization called What's in the Box. And that's where we spend time helping our employees understand that, hey, you're not just shipping the latest X, right? That could be the latest shoes, the latest pants, whatever the flavor of the month is, right? You're not just shipping that, but you're shipping something that really touches the lives of individuals in a very positive way. And so we constantly remind our folks that think of the patient at the end of the line. And all of our employees, right, myself included, is that we know people, family members or friends that have health challenges. Personally, I don't mind sharing, but my youngest son has an autoimmune disease that he deals with. And so I see that medicine show up every month at our house. And it's a cold chain medicine that comes in a cooler. So I'll tell you, I'm very interested when I look at the pack out. How was it packed out? And was it away? But I know that what we're doing are impacting people like my son all the time. And I see the benefit that it has to my son. But when you talk to our employees and they can personalize it and they can make that connection, it makes a big difference. And honestly, I'd love to say that I've never had a bad day at my job. There have been bad days, but there's never been a day that I've woke up and said, I don't want to go to work today, because I know the work that we do impacts people's lives. And that's a driving motivation for myself, and I know for all of our employees. But it's super satisfying. I'd be okay to have less bad days, that happen.
You're in logistics. You're going to have some bad days. There's nothing ever goes completely right.
It's going to happen, absolutely right. But what makes you get through it is just knowing that, hey, I'm doing good today. What I'm doing makes a difference, and that's fulfilling.
Well, Joel, thanks very much. Tell us where people can find more from you and Cardinal.
Yeah. So people can connect with me on LinkedIn. I'm on LinkedIn. But you can also go to cardinalhealth.com and you can connect to Cardinal Health that way. You can also get to our 3PL website through there as well. But I'll tell you, LinkedIn and Cardinal Health's website is a great place to connect with us. Obviously, if we're able to, I'm happy to share my email address as well, where people can reach out directly. But happy to interact with folks that want to understand more about what Cardinal Health is doing and how we can help support them in their efforts to impact the lives of patients.
Great.
Yeah. Thank you.
Thank you very much. We appreciate your time.
You bet. Thanks, you guys. Really appreciated it.
You certainly made me feel old when back in the day. But
you said it, not me.
Super fascinating topic, though.
Yeah, we've been able to talk about moving a lot of different types of freight lately. I think that's been one of the interesting things we've gotten into over the last couple of months of episodes, and now pharmaceuticals and the therapeutics and the very gene therapies, even things like that. I mean, it's very interesting to hear, what goes into that.
Oh yeah, absolutely. And to hear the way he closed it, the way Joel closed the end of it, in terms of how satisfied and how do you feel at the end of the day being able to serve the community that you live in, serve the community around you, and just serve people that have health needs, and to be able to deliver that product when they need it to make their lives better is it's a super great feeling every day.
Yeah, definitely nice to have that satisfaction. And, it's interesting just to think, nationwide, how many people get touched by that. And even if it's not you directly, everybody knows somebody who needs that. So,
absolutely.
Yeah.
But yeah, I've been enjoying learning about the different people and the different organizations and the different products that they ship and how they solve the problems. I've known for a long time in the food industry, they've had like smaller companies can go in consolidation into the club stores. I really just didn't think about it in terms of the pharmaceutical world, just because it's so specialized, and there's not a whole lot of people that actually are. Not a whole lot of people that are strictly within that realm, and they look at each other very much as competitors, and so to be able to pull all that together for the good of all is great.
Yeah, so we thank Joel again for taking the time to join us on this episode, and thank you as well for watching and or listening. Feel free to reach out to us any way you'd like. Certainly, we appreciate you subscribing and following us wherever you do consume this podcast, and comment, leave a review. All of that greatly appreciated. You can also email us at podcast@inteklogistics.com if you'd like to talk to us a little bit more, maybe offline. And we are happy to reach out there. You can go to our website also, www.intechfreight-logistics.com, for more about what we do. So for Rick Lagore, I'm Kevin Baxter. Thanks very much for joining us.
Yeah, thank you.